Let's talk about an introduction to spiritual assessments. Let's consider spiritual assessments as an important part of understanding a person's culture and finding out what their spiritual needs are. There are two parts to analyzing a person's spiritual condition and needs. The first is called a spiritual survey, which is designed to give you an overview of the person's belief system and what gives a person hope. There is an excellent book entitled The Chaplain Skill Set Series, Volume 3, Understanding the Spiritual Assessment by Keith Evans. This excellent resource will be referred to throughout your CPE journey. Several approaches to completing a spiritual assessment are introduced, like FICA, faith, hope, and others. Each of these approaches lend themselves to identifying a person's spiritual beliefs and practices. An assessment, both cultural and spiritual, requires a desire to go deep in your understanding of the person. Now, we suggest a 6-step process to a thorough spiritual assessment. As you proceed through your CPE journey, you will not only have great familiarity with this process, but you will create a custom approach that works best for you in the setting you work and the culture you serve. Know this, only a few of your spiritual care relationships will make it all the way to step 6. Many will end at step 1, but you still must do what you can to bring about a positive outcome and help them move on. Step 1, introduction and survey. This is where you invite the person into a spiritual care relationship. Assuming they receive you and accept the offer, you might engage in some small talk and ask basic questions to learn about their faith beliefs and spirituality. From there, if they will agree to go deeper with you, move to step 2. Step 2, spiritual assessment. This involves one or more in-depth encounters. How do you define the word spiritual? Here you engage in a more thorough and detailed spiritual assessment, using a form and questionnaire that is appropriate to your setting and approach to chaplaincy. There is no one right way. You will need to come up with a process that works best for you. Step 3, pastoral diagnosis. This is the process of diagnosing the issue causing spiritual distress and discomfort. How will you define this term? This will be very important to the way that you approach assessments. This is where you identify the problem causing spiritual pain for your client or your patient. Step 4, care and treatment. This is when a plan of care is discussed. It might include the number of visits that will take place with the person, or possibly the interventions that are desired by the patient or client. The overall purpose of the plan of care is to provide spiritual support that allows the person to reach a place of peace, hope, and comfort. Remember, we walk alongside them toward a positive outcome through active listening, sincerely curious questions, and by providing compassionate spiritual support rather than through prescriptive solutions. Let your patient or clients come to their own conclusions about how to make progress. Additional questions to consider are, who will you bring into the relationship to help? Other professionals, another faith or religious leader, or other members of the interdisciplinary team? Step 5. Pastoral care notes. This is where you develop the habit of charting or taking notes. First, these chart notes help you remember conversations you've had with the people so that you can have better recall when you meet with them again. Second, these notes will help you communicate your spiritual assessment of the patient or the client to other members of the interdisciplinary team. In your notes, you will share the person's specific spiritual needs and desires, as well as the interventions that you provided for them, all with the intention of leading the person to a peaceful, hopeful, and positive outcome. It will be helpful to organize your notes and refer to them just prior to seeing the person again, so you can pick up where you left off. Many of you will have an EMR, an electronic medical record system where you serve as a chaplain. Others of you will have to develop a personal record-keeping system that works best for you in your context. Step 6, exit the professional relationship. This is where you disengage from the person as a spiritual care client. You may have established a friendship with the patient or client and their family members, but the spiritual care plan of care and treatment, more often than not, comes to an end in this step. Like a doctor who does an initial assessment followed by testing to diagnose the physical or mental issues at hand that they come up with, this care plan and treatment plan to help the person heal, we do the same, but within the lane of spiritual care. A good spiritual assessment requires us to become a student of culture, religion, belief, and faith. One of the best tools for learning has already been stressed. It is the tool of asking questions that help you go deeper in your understanding of a person. An assessment is simply a tool to help you do that very thing. When completing spiritual assessments, we must be not only knowledgeable about different cultures, but must also be sensitive and understanding of them. We must learn to engage with people who think differently, talk differently, respond differently, who make decisions in a different way than we do. Chaplains provide compassionate spiritual care without judgment. Chaplains must produce a useful assessment tool to be used in their unique chaplain context. Assessments should be routine for every setting in which we serve. We must dig deep into the question, what setting or people group is God uniquely calling me and equipping me to serve? Is it hospice or hospital? Is it the jail or prison? What about addiction recovery, battered women, pregnant teens, intellectually disadvantaged first responders, disaster response, or the workplace? In each of these settings, you will encounter cultures that are different from your own. Every person, every day, and especially when facing a trial, loss, or illness, will still need to make decisions. Such decisions will be guided by language, upbringing, culture, their setting, family dynamics, faith, beliefs, personal experiences, likes and dislikes, hang-ups and habits and hurts, among so many other things. Always remember that your expertise, your lane, is spiritual care. These assessments can be instrumental to other members of the interdisciplinary team, helping them understand why a person denies a feeding tube or a blood transfusion or kidney dialysis or asks for their pet chicken to be in a small cage to sleep under their bed. When should the patient be told bad news? And when should the family be told first and why? Often the staff will have difficulty understanding why a person wants one thing and will not accept their good advice on another. This is where you come in by creating a bridge from the patient or client to the staff. Think of yourself as an interpreter, interpreting a person's needs, desires, or hopes to another person who speaks a different language. You bridge the spiritual and cultural language barrier. When considering completing a spiritual assessment, it is important to note that most people desire to share their story. They want to share their hopes, dreams, and disappointments with someone who is willing to compassionately listen to their story. In their sharing, they will present one or more topics that should be a clue about what they want to discuss. Your job is to let them lead the conversation. Look for the topics or themes they present and give them permission to share about it. Often they want to share about something on their mind but have trouble putting it into words, or perhaps they feel that they don't have permission to discuss such deeply personal things. Think of it as the person giving you a gift of the topic most helpful for them to discuss. In your listening, observing, and questioning, you are unwrapping a gift and looking inside. What seems to be important to them? Identify a theme based on something they said. Explore it with a sincerely curious question. Listen to their response. Explore deeper with a follow-up question on the topic the person gave you. The client makes a statement and presents a topic. Well, did you notice it? Ask a sincerely curious question about it. Mrs. Smith, I heard you say you lost your baby daughter when she was 2 months old. Would you mind if I asked you, what gave you and your husband strength during such a difficult time? If they give you more information, look for the opportunity to learn more. A follow-up question that goes deeper, still without changing the subject, moves you further to the heart of the matter. Move from the head to the heart. Resist the temptation to change the subject and stay with the topic they want to talk about. You will be amazed at how much healing and peace is produced by helping them talk and share through an issue. Remember, your lane is spiritual care. Stay in your lane. You can't just read questions off a form and expect good results. You need to be engaged, thinking, and empathetically responsive. This implies that you have become proficient with the assessment you use. Proficiency comes with practice. The more you practice, the better you get. In closing, I want to remind you that acquiring information from a patient or client is not always helpful. We are looking for themes that are transformational, not simply informational. This will require you to become comfortable going deeper with patients and clients to areas that other team members are not comfortable discussing. Remember, you are the spiritual care expert and the professional. Go deep with clients in your area of specialty, spiritual care, and cooperate with the rest of the team so that you can produce positive and transformative patient and client outcomes.